As our knowledge of GIST has gone up, I think that now that we're in the molecular age, I'm very supportive of sequencing every GIST patient because 10 to 15% of them, that's 1 in every 10 patients you see with a gastrointestinal stromal tumor, lack either a mutation that's known in KIT or PDGF. And the point mutations in KIT and PDGF that we actually know about, some of them have a unique biology. And so we're no longer in the era of GIST equals imatinib anymore. So for example, if you have a mutation in the platelet-derived growth factor receptor, which we call D842V, this is an imatinib-resistant tumor. But at the same time, it has a much longer, prolonged course to it. And so up front, if you've sequenced these tumors as they come out of a patient and you find that a patient has a D842V mutation, the phase 3 trial we did for adjuvant imatinib isn't really going to apply to that patient. Beyond that, 1 in 10 patients may have what we call wild-type GIST, or ones that don't have mutations in either KIT or PDGF, but they may be these SDH deficient mutations, or patients with SDH deficiencies, which have an entirely different biology. There's a wild-type GIST clinic set up at the NIH, and this group of patients should be treated differently. And so I think as we get into our understanding of GIST, now that we're well past Gleevec equals GIST, and much more into a well-defined disease like breast cancer, where there's a first line, a second line, a third line treatment as long as you have sensitive mutations, taking the time to make sure that the mutations fit the treatment paradigms and not blindly following guidelines is really where we're at now. And so I think, LifeRaft would be supportive of the fact that most patients, which is the most important advocacy group for GIST patients, most patients should still at least see a sarcoma oncologist once. These patients should be treated in the community unless they have special mutations, but you should go and see a sarcoma doctor at least once right when you're diagnosed to make sure your treatment path is the correct path.